Hi, everyone. Welcome back to the COVID313 Coalition for Families and Students. It has been a year. So I lost count of what town hall we're on. But what I do know is that it is the year anniversary of us coming to you on Thursdays. And so it's a somewhat exciting, and we've got a great show for you today. So I'm Christine Bell. I am a proud mom of 3 really wonderful, beautiful, energetic children. I am honored to serve as the executive director of Urban Neighborhood Initiatives. And it also has truly been my honor to be here with you every Thursday, almost every Thursday for the last year. It has provided me so much comfort as a parent, hearing from experts and being able to answer questions, but it's also been very comforting to hear from you that your questions are my questions. And so there's been some solidarity in that. So thank you for letting me do this for the last year. As always, we are translating the town hall to Spanish and ASL. So we want to give folks the right time to get on the right line and get comfortable. Ophelia, will you please give us the details on how to listen to the Spanish interpretation?
Si quieren ver este video en español en vivo al momento, pueden ir al Facebook de DHDC, de Detroit Hispanic Development Corporation, y creo que aquí también en el chat van a poner el enlace. Ahorita van a comenzar en vivo, entonces para ver en vivo este video en español, por favor búscanos en Detroit Hispanic Development Corporation Facebook. Gracias.
Thank you so much, Ophelia. And Julie is with us up first. So good to see you. Could you please provide the instructions for ASL? Thank you so much, Julie. So we want to hear from you, and we've got some really exciting guests today, and hopefully you all will have a lot of questions for them. And so to ask your questions or to comment on what you're hearing today, please put those questions and comments in the Facebook chat, or you can text them to 313-288-2082. Again, that number is 313-288-2082. And we've got Brooke and Lindsay and Libby and Ophelia all waiting to hear from you. And why don't we test out just how on top of it they are? And will you just drop in the chat right now or shoot us a text? How did you hear about the town hall today? We want to hear about how did you hear about the town hall today? So again, you can put your comments or questions in the Facebook chat, or you can text them to 313-288-2082. And it is my great pleasure to welcome Rajeshri, my co-moderator today. So Rajeshri.
Hi, everybody. I am Rajeshri Gandhi Bhatia, and I am the Deputy Director for School Performance for Grand Valley State University's Charter School Office. So I get an opportunity to work with schools in and around the state, particularly focused on the Detroit area, and have great insights into and learn a lot from the schools and the parents and the teachers and families we work with. Today, we want you to stay with us for the next 60 minutes so you can feel informed and empowered in your decision making. We'll be hearing from a variety of experts and invite you to ask your questions as we go along. There's no question that is off limits, so please ask what you want to know and tell us what's on your mind. To ask your questions, please use the chat on Facebook or text your questions to 313-288-2082. Again, that is 313-288-2082. We will have question and answer after each segment. If we can't answer a question today, we're committed to getting the answers to you by next week. All the questions asked today will be posted with answers on DetroitPBS.org. Again, that's detroitpbs.org. For our experts, thank you for being here. Please remember to speak slowly for our translators. They want to make sure that they are translating the important information you're sharing correctly. Also, we ask that you keep your camera off when you're not speaking to ensure that our ASL interpreter can be seen. And we ask that you mute yourself when you're not speaking as well. Terry Whitfield is our timekeeper, and he will chat you your remaining time and let you know if you're getting close to going over your time. Our moderators will also gently remind you to wrap up. Christine, I'll toss it back to you.
So much. Okay, so we have a really special town hall today that includes community and health professionals who can share information and answer questions about vaccines and COVID policies. And first, we will have Molly of 482 Forward give us some updates about the COVID relief funds for schools. So, Molly, we don't often get to see Molly.
First,
she's
we're
usually...
gonna have... Yeah, I'm here.
Oh, go ahead.
I do know before I go, though, Brooke and Ophelia are going to do the parent voice.
Oh, okay, great. So before Molly, Brooke and Ophelia.
Hi everyone. Oh, oops, sorry.
Hey, Brooke. No, go ahead. Hey, Brooke.
Hi, Christine.
It is quite my honor to introduce Brooke. She works for my organization, and she is an amazing human. So, Brooke, please.
Thank you, Christine. So, hi everyone. I'm Brooke. I am not on camera today, but I hope you all can see my picture. That is me and my lovely son, Lionel. So as I mentioned, I want to say thank you to everyone, all of our viewers. Thank you to our partners, Detroit Public Television, for giving us a platform, Detroit Parent Network, UNI, DHDC, COC, Mothering Justice, Chas Clinic, 482 Forward, and all of the rest of the organizations who make up this wonderful coalition. Thank you for watching, sending us your questions, your comments, concerns. And a special thank you to all of our guests who tune in every Thursday religiously to inform, to watch us, to hear from experts. So thank you for everything you guys have done, for your continuous support. So as mentioned, I am the parent community voice today. I myself am a resident of Southwest Detroit. I am the proud mother of a 2-year-old little boy, Lionel. So why has this program been important for me and my community? Well, I guess I wear multiple hats. This year, I was a mother, a graduating student, and an involved community member. COVID313 holds a special place in my heart. A year ago, we were all thrown into the unknown and did not know what to expect as we faced the COVID-19 pandemic. I was scared. I struggled with anxiety and the uncertainty of the virus. However, through the ongoing support of my peers, colleagues, those fears slowly began to fade away. Instead, after listening and speaking to experts and medical professionals, I started to become an ambassador for my Hispanic community. I was able to bring back important information I learned from our town halls and inform my community, my neighbors, and my family. And I was rest assured that they were getting accurate and reliable information from someone they knew and trusted. As a proud mother to my 2-year-old, I was able to express my frustrations and concerns with other parents who knew what I was going through. We had people from Mothering Justice, Detroit Parent Network, and other organizations come on and talk about how to deal with children while being quarantined. And through those conversations, I learned how to better acclimate my son to the circumstances we were living through. And as mentioned, I also happen to be a college student in the middle of a pandemic. I finished up my senior year at the University of Michigan, Dearborn, and it was very difficult. College itself is hard. College with the baby is harder, and college during a pandemic, Oh, you can only imagine. But then again, if I've learned anything throughout all of this, is to be patient with each other and with ourselves. We're not machines, we're people. We're allowed to feel upset, stressed, and even angry. But again, I owe a lot of my sanity to my colleagues and our guest speakers who have come on to share their knowledge and their wisdom. I personally, and I think I speak on behalf of everyone at COVID 313, we want to thank you all for what you have done and continue to do. Thank you, and I'll pass it on to Ophelia.
Wow, thank you, Brooke. Yeah, so my name is Ophelia. I am a community organizer here at DHDC, at Detroit Hispanic Development Corporation. And as part of the community, right, I don't know if anybody has Snapchat, but in my Snapchats, they give memories of how things were this day last year and years before. And to see the difference of, you know, being at concerts, being in with family, and especially working, right? I always joke about, I never thought we would say like, I miss being in the office, but I do. And I think being a community organizer, COVID kind of took the community from us in a sense, but at the same time, it built us and we became stronger, right? So my team at DHDC and many other orgs, especially many who came into this coalition, came together and said, our work is on pause, our communities in need. How else are we going to continue to do the work that we're doing? And this is one of the platforms that we have. So thank you for everybody who's been part of this coalition for over a year, 52 weeks of videos, of information. Thank you to all the panelists and to the community, right? So this was another way for us to reach our community. Our work doesn't end. We just had to figure out new ways for our new normal, how to continue this work. And so also to remember, this is a time of reflection, right? I feel that this has made Detroit a lot stronger. We always say Detroit strong, but I feel during the time of the pandemic, Detroit did become stronger, right? We're looking for our community being there, trying to help everybody with food distributions, with information, with sites of testing and vaccination. I really feel that's what our city is about too, right? So I feel even though COVID has done a lot of awful things and has hurt our community, but it's also brought us together to build stronger. So I'm hoping in the future, Detroit, we stay Detroit strong and we can continue this information and one day continue to help the community and be with you again. So thank you.
Thank you,
And thank
Ophelia.
you, Brooke.
Oh, thank you.
Go ahead, Brooke.
Christy. So yes, you know, as a highlight of this town hall, we're really reflecting on everything that we have been through in the last year. And in doing so, we want to have 1 minute of silence for the people we have lost during this pandemic. I'm not sure of the exact number, but we know that at least 500,000 people have lost their lives. People have lost parents, loved ones, sisters, children. So if we could please take this moment to remember those and honor what they have what they left behind. We hope their souls are in peace, and we hope that they are finding comfort wherever they are. Thank you.
Thank you so much, Brooke and Ophelia. And thank you all for joining with us as we honor those that we've lost. And thank you. So now, without further ado, Molly Sweeney from 482 Forward, who is normally behind the black box, making things happen for us on this town hall. She is going to share with us where we are with the stimulus dollars, specifically for education. So, Molly, thank you for joining us
I'm your
in person.
I know, in person.
Yes, yes.
It's funny to be on the other side of the box. So I'm here as a quick replacement, not as great of a replacement for the 482 policy director, Elisa Hurd. She's sorry she couldn't be on. She had to take her mom to the doctor, which moms come first. So I'm just going to give a brief overview for parents and students that are watching about what is going on with this federal dollars that are set aside for schools right now. And Brooke and Ophelia, thank you so much for reminding us of all the folks that were lost and how hard the last year has been, because these COVID relief dollars set aside for schools are supposed to be able to support our communities to move forward and to heal, to have the resources we need to continue to grieve and to repair what we've lost given the last year. So for Michigan, we've had now 3 packages. So remember that we've had 3 packages set aside from the federal government for schools in Michigan. The first 2 were roughly around $1.9 billion. And this next one will be another billion or so set aside for Michigan schools specifically. So when you hear that, it is true. It is a lot of money set aside for our schools. And this money right now is supposed to be spent by our schools between now and September 2023. So now through September 2023, we are going to have a large infusion of money into our school systems, which is really exciting news, but it's really important to remember as parents and students, this is one-time infusions of money. So we need to remember when we're thinking about this money that we still need to be thinking about raising revenue for schools overall. For everyone's, a reminder for everyone, Michigan schools before this pandemic had a $3.1 billion deficit, meaning we were $3.1 billion. We need $3.1 billion for our schools to be fully funded. So this infusion of cash is really, really good for right now through 2023. But when 2023 hits, we are still gonna see that we have a large deficit in funding our schools for our families and for the things that we need. So just to keep that in mind, that we need to be really focused on raising money for our school systems. So this package, so $1.9 billion is in the hands of Michigan right now. That's the first 2 packages. We don't have the 3rd package yet. And that money over the last 2 months has been debated in our appropriations committees. So there have been 2 representatives, Representative Stamas Senator Stamas in the Senate and Representative Albert in the House in Michigan, that have been putting together a budget for this money. And ultimately, once they submitted their budgets to the governor has to approve it. So this was a really complicated process, and Senator Stamas and Representative Albert put forth packages that allocated about $1.1 billion to schools, and about 800 million of that money, though. So remember, we have 1.9 million, 1.1 billion they presented to the governor to just be given to schools. About 800 million of that money, which is why we still need advocacy, they said can only get to schools' hands if the governor, agrees to give up the governor's power and around decisions around school sports and schools to the local health departments, which is a contentious issue. And so that package went to the governor, And what the governor did with that $1.9 billion, she said, yes, I approve the 1.1 billion, but I'm going to veto. I do not believe that the governor's office should be giving up our powers over schools to the local health departments. And so that 800 million is not going to be allocated to schools until we can agree as a state what the parameters around that money is. It's really important, and we'll need our advocacy as families. And I will put a link at the end of this about how we can advocate. But that money, if it's not allocated by July, by July, that money potentially could go back to the federal government. So if we don't use it, we lose it. The other thing that's important about this 1.9 billion around schools is the governor also vetoed 87 million of that money to go to private schools. So there is a state constitution. The state constitution of Michigan says public dollars cannot go to private schools. So our governor stayed true to that in this package. She vetoed $87 million for private schools, and another 10 million that was set aside for private after school programs. She also vetoed that. The other thing she did for the sake of fairness, so this money was allocated per student, the 1.9 billion. So just students who had needs. So it was allocated per need of students. So that 1.9 billion, it went a little more to schools who had more students who had Title I needs or students who are lower income. And that left some discrepancies across some districts that don't have as many low income students. So the governor also took 170 million from our state budget to set aside money so that every child in Michigan gets at least $450 additional. Now, again, districts who have more Title I students are going to get significantly more. For example, Detroit students are looking at close to $8,000 more per student, plus probably more in this next package. So we'll probably get up to about $20,000 a student soon. So that is the key updates on the ESSER money. If you are interested in activating yourself around this, you can go to michiganedjustice.org, michiganedjustice.org, and send an email to Rep. Albert and Rep. Stamas to tell them to take off the requirements on that $800 million if you're interested. So that's on the ESSER money. The other really important thing to know legislatively for Detroit is that just introduced last week was a bill to allocate $94.4 million to Detroit schools, Detroit public schools, as part of the settlement of the literacy lawsuit. So that bill we're going to be tracking pretty closely. That was an agreement the governor made to give an additional $94.4 million to Detroit schools because of the literacy lawsuit. So that's a bill that was just introduced, and we will continue to help you be up to date on that over the next few weeks. And that's all I have, Christine.
I have a few questions.
Oh,
I think you also have a few people that are waiting to be admitted. So, yeah. Okay. So, what can the money be used for?
So there's a broad range of things it can be used for. It's actually really beautiful in this moment for families and students. And we're going to create some containers for parents and students to get activated around this because there's so much opportunity. So really, it's for student relief. So it can be used for anything from counselors to paying teachers more, to allocating more staffing, to also upgrading the building. So what's important with COVID, we know there are expenses around ventilation systems. So everything from supporting students to renovations of buildings, this money is going to be really used for. It's very broad.
So Molly, $200,000 a student is a lot. Will charter students get money as well?
So it'll be about $20,000 a student, not 200. If I said that wrong.
I meant to say 20,000.
That's a lot of money.
I'm sorry.
I mean, I'd be happy with that. We'd be happy with that.
$200 is like, yeah.
Woohoo. No, so it's about $20,000 in Detroit. We're looking at about $1 billion overall for Detroit schools, including charters. So a lot of our charters are getting more money as well. Not as much as our traditional public district, but we have a list, and I can put that in the chat too if folks would want it, of every school in the city and how much they're getting. It is true there's a piece of this money that's set aside for capital, for buildings, if you have more buildings. And so districts like Detroit are gonna get a little bit more because of the number of buildings we have.
That was going to be my follow-up question, Molly. Does it have to do with the student population makeup of why charters might get a little bit less or the same amount, and then the physical infrastructure is the other piece? And is that because DPSBD owns their buildings and charter schools might not? Or can you say a little bit more about that?
It was all based on the federal formula, which was around number of Title I students. So it's like when we got this money from the feds, they said to Title I students, and then there's a little bit of a bump for the number of buildings you have. I don't know if that's about ownership or like just occupying buildings as a school. I can find out, but the number of buildings you have is a part of the amount of money allocated to your schools.
Great. And then do schools have to be in person to get the funds?
No, there was a piece of the money that was around if schools, they had to have some level of in-person, but no, you don't need to be in person to receive these funds.
So that means if a school decides, if the district decides, we're gonna have a hybrid option next year, then they'll still get the funds, and they might just use those funds for virtual reasons, since there's a lot of infrastructure with that as well.
Yeah.
Great. Does each school get to decide what they need, or does it go to the district?
So it'd be the way the schools do their budgeting process, which is through the district. Every district has a different process. Every school needs to submit their budget by July. And one thing that 482 Forward is going to be proposing to our membership, but I think broadly to the community, is that we believe parents and students and educators should have a say in this money. And so we want to be able to make sure that communities across the city and across the state are able to tell their schools, here are our priorities going into next year. Here's our priorities for what we need, whether it be more counselors, more mental health supports. We want to make sure the buildings are repaired, but that families are partners in making these decisions.
And it doesn't stop any parent right now that they know that this money is coming, to call your school and start talking with your school about what you need as a parent, right? Or what you think your child needs, or maybe what were some of the things that were hard about virtual learning and what might have made it easier, so that 100%. Schools can really start thinking about, where best to use these dollars, since it is only a one-time use, and that's probably not going to necessarily mean, hiring a number of staff that are long-term staff positions, right?
Exactly.
So now that you know this, parents, students, start talking, start saying what it is that you need.
Yeah, I would say
what were you
what you need. Go to finance. If you have a finance committee, go to your board meetings, and if you're interested, join 482 Forward. Always a plug.
I'm glad you made that plug.
Join your local organization at UNI, DHDC. Make sure you get involved, because this is going to take not only allocating this money, but it's also going to take long-term accountability of where this money goes and how it's spent. Again, I can't emphasize, we're about to have $1 billion, most likely, for Detroit schools. And that is between now and 23. We might get an extension to 24, but that's a lot of money. And we want to make sure that is correct. Thank you, Representative Tlaib. So verified by the Congresswoman, $1 billion. And this is an opportunity. And we're really excited to be able to think about with parents and students about how do we then shape this, right? How do we shape where this money is and make sure it's shaped by our priorities, not necessarily the priorities of folks who aren't directly impacted.
Absolutely. And yeah, absolutely. What happens, Molly, do we know what happens if they don't spend the money, if schools don't spend the money?
Representative Tlaib can probably tell us. If we don't spend it, we have to spend it. So one, we have to spend it by 23 unless we get an extension. If our state doesn't allocate it, it will go back. It'll go back to the federal government, and then Representative Tlaib is going to have to renegotiate and make sure Michigan gets money again. But we don't want to spend the money back. We already have a $3.7 billion deficit for our schools. We're getting about $1 billion. I mean, this is across the state. People are getting this monmoney. And the Congresswoman just pulled my camera, so I'm going to let the expert tell us about the federal money.
But we are, Representative, we do have somebody that wants to introduce you, and they are so excited to do so. So I want to give Ophelia the opportunity to do that. Let me thank Molly and let your voice be heard. This is an amazing opportunity for us. It's an amazing opportunity for our kids. So, all right, Ophelia, you're on. Oh, she's connecting to her auto. Yep, there you go. Go ahead.
Welcome to Zoom, everybody, where there's technical difficulties everywhere. So I am so excited to present and honored. I like to call her Southwest's very own superwoman, Rashida Tlaib. Welcome to the COVID313 Town Hall for Families and Students. And thank you so much for giving us some of your time of your busy schedule and with your new puppy. So bienvenida, Rashida. Please share with our viewers any new information that you have in regards to the stimulus, unemployment, and this $1 billion that is owed to us. Thank you for coming.
No, thank you all so much, Ophelia. Thank you for the introduction and all the advocates that are listening, all of my parents, folks from our school community that has been, really important partner in ensuring that the federal government is about people and about protecting our families and our children during this global public health crisis. I want to share my screen. I've only done this a handful of times, so bear with me. It says it's disabled. I think somebody disabled it, but I don't know if you have it, if you want to share it, Christine.
Representative, yep, we've got it.
Okay, great.
We've got it.
You can use the most up-to-date one, pull it up. That way I can go through a lot of, great, this is wonderful. Okay, so I want to go through some of the really important aspects of the American Rescue Plan. By the way, just know that I wanted more. I think $15 minimum wage should have been part of this plan, but I'm not done fighting for that. And for people that live in the 13th Congressional District, even if it doesn't impact you, know that it's 38% of our neighbors would have gotten that $15 minimum wage increase and really help elevate them out of poverty. Other aspects here is also, really my push to require reoccurring payments. A lot of other countries are not just doing the one payment. After 1 year or 8 months of the back and forth between the House and the Senate, having people know, look, in the next 4 months, this is what we're going to be able to offer you as you try to adjust to the loss of income and really just the public health crisis impact on your family. So the direct $1,400 survival checks are going to many of our neighbors, including adult dependents. That was a huge fight. Some of us still have children over the age of 18 that we claim that we are supporting. And so it's really important for them to be able to receive the same support. In there also, and I think we talk about it maybe on the next slide, is the enhanced child tax credit. And I'll talk a little bit more about that. I don't know if you can go to the next slide real quick. There was the slide. I'm so sorry. Thank you. Here it is. The next slide. Sorry. Thank you. This is the one I want. So $1,400 per person, per child, per adult dependent, $40 million for food, rental, utility assistance, including water bills. So if you know somebody, and we have a lot of neighbors that are taking advantage of the moratorium for good reason, and it's important, but know that this is money that is in addition to the direct assistance that you're going to get. And so it's really important. So I'm hearing a lot of folks talk about, hey, I got the moratorium, I'm not going to worry about it. I'm like, no, worry about it now. Get those months paid off now while the resources are available. And my office and others will continue to share with a number of the nonprofit organizations and advocates on how to access that through the Wayne Metro Community Action Agency and other agencies that are providing that support. Also is $1.2 billion in local municipal aid for the 13 district strong communities. This is important. Why is because, you know, smaller communities like Ecorse and Rouge and Inkster and other places did not actually qualify to get direct state and local help. So a lot of funds, you know, many of them, just like our neighbors who are living check by check, many of our cities were really living the, you know, kind of like a check by check process and not having enough resources and the ability to, you know, make sure we stop the spread of COVID. So this is really important. The 1.2 billion alone is just for our 12 communities in the 13th district, including the city of Detroit. The other one that I love is it enhances the child tax credit to 27 million children, cutting poverty in half in our country. What this means is $3,000 per child that you'll be receiving from the age of 6 to 17. And then if you have a child that's at age 6 or younger, it's $3,600 per child. And again, this is a tax credit to you all that you have access to, and many people did not have access to it before. They're going to now have access to it, and again, helping about 27 million children. There's some more information about income-based credit that is phased out for individuals earning more than $75,000 a year or $150,000 for those married filing jointly. But many of our families, as you all know, are much more lower income. And again, though, the child tax credit and the direct aid is going to be really helpful. What also I love, so the monthly, so you'll receive a payment monthly, similar to how you receive your stimulus check, but it'll be, again, going directly to people's accounts. And we're going to be helping people file the right paperwork and making sure that our underbanked and unbanked folks are still going to have access. So you'll look out for that. Now let's go to our schools, which I know this is the one that you're all most excited about. If you wanted to give the other slide, the previous slide, I believe. Christine, I hope she's still there. Thank you, Chris. Okay, so going to the sends, okay, so $130 billion, what is that? And of course you heard from Molly that $1 billion is true, is going to our Detroit Public School District. This is to open our schools safely. You hear a lot of people say open, 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 but many of our teachers, our students, our parents are saying, but we need to open safely. And that's the most responsible thing we can do right now, especially because we are hearing about children. And we lost one of the youngest in the nation at the beginning of the pandemic was 5-year-old Skylar in my district. Both her parents were frontline workers and they watched their child, even though the previous administration and others said that children could not get it and they could not die from COVID. And that was a complete false statement. And as we continue to see, it does impact children. So we've got to make sure we protect our kids. What I love about the funding is it's to repair ventilation systems or maybe to implement ventilation systems for many of our older schools. Other one was really, really important is reducing our class sizes, implementing social distancing guidelines, right? Purchasing PPE. This is my favorite, hiring support staff to address students' well-being. So this is like counselors, things again that right now, there was such a lack in those resources for the well-being of our students. And now pandemic has just made it worse, that we want to make sure we provide that aid. And there's the approximate, we are continuing to say approximate because we will get the final dollar amount, but that's how much Detroit Public Schools will be receiving. The American Rescue Plan sets aside 20% of the money for long-term learning loss by providing after-school programs, which are going to be really important for many of you all as our partners in the community, summer learning programs, extended school days. I know our kids don't want to hear it, but it's needed. And then re-engaging our students who have been absent from remote learning and hiring, again, those counselors and nurses to care for our students' emotional and physical well-being. That is something that many of us, including myself, were very much big advocates for and wanted to push for. And then with that, I can answer any questions or anything else that we might be missing. As you know, there's $20 billion in there to expand vaccinations through our community. What I love about the expansion of the vaccinations, it's not just direct shot in the arms, but also becoming more mobile and allowing more mobility. So going to communities, churches, or senior buildings, a number of other places, and maybe at one point going to actually our schools and being able to get our kids, when we do have a vaccine for our kids under the age of 16, to be able to do it in that way. And then also the expansion of vaccinations to our pharmacies. Myers and Rite Aid in the state of Michigan were able to be chosen to receive direct shots for vaccinations that are not part of the allocation for our state. So that's in addition to what's coming to our state. And again, with that, I'll answer any questions.
Hi, how are you? It's so good to see you. So one of the questions that you and I need to call you representative, and
no,
it's hard because I just
it's fine.
I know. Okay. So Rashida, could you talk a little bit about unemployment and what the American Rescue Plan did for unemployment?
Oh, thank you, Christine, for that. I'm so sorry we didn't include that. Really important, we do extend unemployment. I wanted to keep it at $400, but it's at $300, but it will be until the end of summer. And I'm already hearing people talking about the possibility of extending that. Continue to talk about the importance of that additional federal unemployment stimulus that's added on to your current unemployment that you might be getting from the state. Again, this is $300 per for your unemployment benefits that is extended until the end of the summer.
Great. And then I know that at the end of the month, the moratorium on evictions is supposed to be lifted. Is there anything in the American Rescue Plan that extends that moratorium? Or could you talk a little bit about that?
Yeah, I believe we did put an extension there, and I know Larissa's on. Larissa's going to get me the data and put it in the chat. I want to make sure I always get the dates wrong, but I don't believe it's again. I don't think it's an extension that you're going to see months down the line. So that's why just yesterday I was talking to advocates to really try to encourage our neighbors to please go ahead and start applying for the rental assistance. I think many are waiting for the moratorium to end, and I'm urging them to please go get help now, because what's happening is, folks are going to wait, and maybe that pot of money might be gone by then. But also, some are saying, well, I'll just wait and just get evicted. I've actually heard people say that, and I tell them, no, it will actually impact whether or not you're able to qualify to be able, folks will use that against you not to rent to you in a future other home. But really critical for many of our neighbors now that we've made it flexible. So you don't actually have an eviction notice. You can just show that you haven't been able to pay, that you lost your job, that this is the situation. And so it's really important that again, people are applying for the rental assistance. And this is a significant portion of the money. And now landlords and tenants can apply together. Which is also very, very helpful in some cases. I know that people ask for that. And again, anything we can do to make sure that people are applying for those funds.
Rashida, I think I just want to summarize what you just said, because I think that that's really important. So what I heard you say is, don't wait to apply for the support for rent, and that if you and your landlord have a good relationship, that you all, or not, but you guys can apply together, and that you shouldn't wait until the moratorium is lifted.
Yeah, and so, there's a state moratorium, I believe, that it got extended. So that applies to us. But again, I know there was a federal moratorium. I just got to find out what it was. I don't think it was this long period of time. Primarily, I think what I've been hearing a lot of folks and colleagues say is we got to push people to actually apply. And this is the reason is because we had money for rental assistance in the last COVID relief package. And a lot of that money sat there. It was there because people had the moratorium to rely on. So folks, and I know my mom was the same way. My mom waited until it was time and that it was going to get shut off. And so I'm asking all of us, please encourage. I know they can't get evicted now during the moratorium, but that rent's going to be due, and you're going to need help to making sure that that we're able to again get that assistance. And I want to make sure that our residents that desperately need it are getting it. I mean, last time around I saw that funding be used to up to 4 months of rent back rent, to pay water bills, utility, and so forth. So it's really, really important that we encourage our residents and our neighbors that are that aren't able to pay their rent to apply for the grant, because that money sat there on a table, Chris, millions of dollars, because people, had the moratorium to lean on. So
that is really helpful advice. And I just want to say, Larissa put in the chat that there was $40 billion in this plan, I believe, for mortgage, rent, utilities assistance, and food assistance. So $40 billion. Well, I'm just making sure we don't have, we have any advice for struggling families in this category, and what assistance will be available for people that file taxes with ITN numbers?
Yeah, so your dependents and those folks are going to most be able to get the $1,400. There was a huge fight, and I believe and again, I'll verify, and I'm so sorry I wasn't more prepared for that question, because I know we put it in the House and then the Senate, and then it comes back from the Senate completely like botched in some cases, in some areas. So I know that we put it in the original to say, if you have an I-10 and you filed, then you qualify for the direct assistance. I think though, the way we did make the final change possibly, and again, Larissa can double check, is if there's mixed statuses within homes, that will not prevent you from actually getting the $1,400 or some of the child tax credit for your kids, but we'll double check and make sure. I'm almost sure the child tax credit will still be able to go to our US citizen children, and even if your parent is using an I-10.
Great, thank you so much, Rashida. And somebody just wrote, I received my first 2 checks directly in my bank account with no problem through Chase. However, I haven't received my 3rd one. There's been no changes on our account. So I'm reading that out loud. We'll make sure that, I'm not sure that the representative can answer that question, but
well, it's good for me to know. It's also good for us to know, because we need to know if it's going through, and then we need to ask IRS, hey, is something wrong? Like, why isn't my residents getting it? So it's really important for us to make sure that that if you are, haven't gotten it and usually do get it, then, we got to figure out what some of the issues might be. So you can reach out to our office, and our number is 313-463-6220. Again, 313-463-6220. And we are a bilingual office. So we will have people we do have folks that speak Spanish and Arabic in the office.
So, and those of you that ask, where is the money going and where can you get the help, we will make sure that we get that out to you. And in the coming weeks, we'll have those folks that are taking the money and then distributing it come on to tell you exactly how to access it. Representative Tlaib, it is always a pleasure to have you here, and you look so powerful in your chair. And
you can dress me up, but the Southwest Detroit girl is definitely still in me. So,
well, you look powerful either way, but it is always a pleasure to see you and have you here with us. And I feel very lucky that on the year anniversary of us starting these town halls, that you were able to join us. And thank you for all that you do for us every day. Thank
you. And please know, we'll follow up. We want to make sure you all have links, access the information, and not all of our residents want direct deposit. And I understand that. And all those processes, again, we're getting that information and guidelines from the IRS now. And then, I will be the first to say the money has hit Detroit Public Schools account. So I will let you all know when that happens, when the money does finally reach our folks. I do need your last minute partnership. Please, please, please don't let the Michigan legislature hold the money up. The assistance to our local communities and the assistance to our schools still has to pass through the Michigan legislature. So please help me in making sure that our our public servants and our folks in the Michigan House and the Michigan Senate legislature that they're not going to hold this money up as they hold some previous millions of dollars for vaccinations up in the previous package. So please help me out in any way you can. There's Republicans, Democrats, Libertarians, this touches everyone's lives in a very positive way. And we need to get the money to our communities right away. So please support us in making sure that they don't play political games with money that our communities need now.
Great. Thank you so much. It's always a pleasure. You have a great rest of your day, because I know you got us in the middle of your busy day. So thank you so much.
Thank you.
And I'm gonna pass it on to Rajeshri to introduce our next panel. I did want to say there's a couple of folks that are commenting that they would like to know more about how they can get involved in some of the work that Molly, you talked about. So if we could drop that information in the chat so our moderators can put it out on Facebook, that would be phenomenal. So Rajeshri, it is on to you.
Thank you so much. As we continue to bring a diverse expertise to all of you, we thought it was important to hear from a variety of experts who can offer their perspective on some common questions and concerns. A few weeks ago, we shared some reasons that members of our community were apprehensive about getting the vaccine. And many of these concerns center around risks and varying levels of trust with science and the medical community. Our goal is to validate the way that people are feeling without judgment, and also offer factual information to help increase comfort levels and empower individuals to make their own choices with confidence. We know that there are folks, particularly from the Black community, who distrust the medical profession after historically suffering abuse in the name of science. We know that there are many parents who worry about the long-term effects that all vaccines can have, and who worry about potential links between vaccines and other conditions, whether they're true or not. Still others do not feel as though they're informed enough to make a choice that feels right and that you can have confidence in. So to that end, we have a group of individuals who will speak on a panel to answer some questions. But first, I'd like to invite Dr. Howard Markel of the University of Michigan to share with us a bit about the history of vaccines. While Dr. Markel is speaking, I'd appreciate if all the other panelists could turn off your videos so that our ASL interpreters can focus specifically on him. Dr. Markel, welcome, and you have the floor for 10 minutes.
Well, thank you. 10 minutes to give you an entire history of vaccination, it seems rather daunting. But I guess we have to start a few hundred years ago in the 1790s with one doctor, Dr. Edward Jenner, who was in Gloucestershire. He was a country doctor who would travel by horse and buggy from patient to patient, talk about house calls. And he noticed, there were a lot of smallpox epidemics in Britain as well as in America, almost annually at that time. It was a very deadly disease. About a third of the people who contracted it died. Those who survived, many had terrible scars all over their face and body, and some were even blinded by it. And so he noticed that milkmaids, young women who milked cows in the countryside, who did not seem to get smallpox when smallpox epidemics spread through their community. And he wondered why. And he talked to some of the milkmaids, and they said, well, we've already gotten cowpox infections, and they showed on their hands the little blisters, but they were fairly benign. They weren't all that severe for a human being. And what it turns out is, we didn't know this 200 years ago, but that almost every mammal species has its own pox virus. But when we humans are immunized with the cowpox virus, which was called vaccinia, hence the name vaccination, but when you were injected with that mild lymph or pus that it produced, you were also immune to the bad smallpox. Now, there were people, by the way, who would inoculate themselves with the scabs and the pus of people who got smallpox as a means of inoculating themselves. And that worked for about a third of the people, but about 25% of them got very sick and died. So that wasn't a very good method of vaccination. But anyway, vaccination caught on for smallpox around the world. Thomas Jefferson was a big fan of it. He was the first president to declare a national health scheme, which was to immunize as many Americans, to vaccinate as many Americans against smallpox as possible. He even sent some vials of it with Lewis and Clark on their expedition to vaccinate people they met along the way on their travels. Now, the issue about that was a lucky guess because we didn't know anything about microbes or bacteria, let alone viruses, which cause a smallpox is caused by a virus. We didn't have the means to study them, let alone understand them. We knew nothing about immunology and the various cells in our body that fight off infection. So that took another couple hundred years of modern science, bacteriology, immunology, physiology, cellular pathology, and so on. And it wasn't until the 1930s that we started developing vaccines for childhood infectious diseases such as diphtheria or whooping cough. And in the 50s, most famously, polio. And one of the questions that you ask is, are these vaccines safe for my children? Well, the proof is in the pudding, is in the tasting, really, because we've vaccinated billions of children with these vaccinations, the various vaccinations we give, without any serious or untoward effects. And even with this new vaccine that we're developing, with the first vaccine for an RNA virus, and it's been developed in only a year, has been shown to be, the various versions of it, very safe. And even the one that was pulled off the market temporarily, the AstraZeneca, because of the few cases of blood clots, you have to remember those were 2 or 3 cases among millions and millions of doses. So what we have learned in the long history, how am I doing for time, by the way, because I'm not looking at a clock. Well, I've got a few minutes. In the long history of vaccinations, the 300-year history of vaccinations, I could look everybody in the eye as a physician and as a historian of infectious disease, that if you had to list the top 10 greatest hits of the history of medicine, the greatest achievements, 9 of them would be the various vaccines we give. Maybe 10 of them would be. I may be underestimating it. And this COVID vaccine developed in such a quick fashion, only 10 to 12 months. That's a world's record, is truly remarkable. But we don't give vaccines unless they're shown to be safe, and we monitor them very carefully in case anything happens, which is what we are doing now. And I look forward to a robust discussion. But as a pediatrician, okay, who has given thousands of shots in my career, okay, until I learned the trick of having a nurse do it so the kids didn't hate me. But given thousands of shots in my career, I can honestly say, and the studies have shown, they have saved literally hundreds and hundreds of millions of lives. And these diseases are not good diseases to contract. They are very dangerous, they are very deadly, and they can damage organs in your body even if you survive them. And we're learning that about COVID as well. So I guess I'll stop at that point, and then can take questions. It's so hard to encapsulate such a broad history in 10 minutes.
Well, you did a great job. Thank you very much. We'd like to welcome you, Dr. Markell, to our all-star panel, and I invite the panel to join us now with your cameras and mics on. That includes Dr. Dennis Cunningham of Henry Ford, Dr. Castillo McKenzie of the University of Michigan, Dr. Richard Bryce of the Chass Center. I'm going to ask you some questions about vaccines, both in general and specifically for COVID-19. And we know that this esteemed panel can provide information that answers these questions and help our audience feel more empowered and informed. And so first off, I want to say we're incredibly grateful to each of you for giving of your time and expertise today. Thank you. So let's start a little bit, Dr. Markell just gave us a good overview of the history of vaccines. And I'd love to hear from some of the other folks on the panel, just kind of what are your thoughts about the history of vaccines and vaccinations in our country, and both the good and the bad?
Well, I guess I could start. I think one of the things that is important to understand is that you know, every medicine or medical treatment that we have does have some risk, and even vaccines do. And I think Dr. Melkel kind of hinted at this. And of course, you know, people have side effects and reactions, and even unfortunately, there's been some that have died related to getting vaccines. But if you look at the overall picture, they're so important in terms of preventing for a full population, for everybody. They can prevent so much illness, so much death related to some of these just tragic infections that are there. I think the thing for us as medical providers, and I know for myself speaking for Chaz, is I think we need to make sure that we understand the benefits, but we also have to understand the anxieties that may be coming from our patients and from our communities. So I think we've made some errors in the past, I think, in some of the, you know, the messaging that we've given, and we just have to be a part of, hey, how do we support our community? And when they're ready to do the vaccine, we want to make sure that they can do it. Explain all the information that we're going to do today so people feel safe and understand the benefits of the vaccines. But I think in the end, we are closest to the patients that we take care of, and we want to kind of explain our reasons for why we think it's important for all of us in the end. So thank you.
I agree with Dr. Bryce too. I think, you know, vaccines are one of the most powerful interventions in public health and in science that we have. And they've been very important for our communities, and they've eradicated, you know, important diseases like, you know, like smallpox and, you know, polio and things like that, and other, you know, infectious diseases that, you know, the vaccines have been one of the most important interventions, like I mentioned. Unfortunately, you know, there's been some hiccups previously during the vaccine history, and I think that has contributed to, you know, sometimes in our communities to have some mistrust, you know, regarding vaccination. But that's why we're here today, to help, you know, our communities to understand vaccines and, you know, to trust vaccines and to know that vaccines are safe and they help us and they help our communities.
I would echo that. Chances of severe allergic reactions to some vaccines, such as measles, you're talking 1 in a million to 1 in 10 million. Before I joined Henry Ford, I worked at one of the largest children's hospitals in the country. I've taken care of children who wound up either dying in the hospital or admitted to the ICU for diseases such as chickenpox, whooping cough, and some others. To me, the vaccines are one of the greatest gifts I could give my children for their protection. I'm very passionate about them. My message is not to twist anyone's arm and say what you have to do, but if I can answer any questions, I'm more than happy to do it. Everyone should make the decision right for them and for their families. And if I can provide any information, I'm happy to do that.
Great. Thank you so much. And some of you, you know, and as we talked about, you know, the vaccines, you all alluded and talked a little bit about why get a vaccine, but can one of you take a moment and just kind of explain the herd immunity concept and who it applies to, how it applies, like how does that fit into the effectiveness of vaccinations?
Herd immunity applies to a population. What it means is that there's enough people in the population who are immune to a disease that when the disease comes, there's not enough people for transmission to occur and to have an outbreak. You can become immune from either having the infection or you could get it from a vaccine.
Okay, great. Does anyone have anything they'd like to add?
Well, you know, it's a pediatrics term, and it's really a mythical beast because it was always assumed, particularly by the 50s and 60s, when there was mandatory vaccinations and a whole panel, not just 1 or 2 vaccinations for kids to get into school. And, you know, you could not get into kindergarten, public or private, in this state and many states in the union without a little passport that was signed by a pediatrician that you got all 3 of your polios or all, you know, whatever, you know, and that had to be filled out. Well, back then you assumed that your community of kids had a lot of immunity to measles or what have you, because 95% or more of the population of kids had vaccines. Now it's not quite so easy. In some places like Orange County, California, fewer than 50% of the kids were immunized against measles because of old, outdated, and completely wrong data that connected it to autism. Ladies and gentlemen, everyone else in the audience, the autism is not connected to the measles vaccine in any way, shape, or form. And the guy who said that, a man named Wakefield, was listed by Time magazine as one of the worst scientists in the history of science. How would you like to have that? It's your appellation. And he deserves it, but it's caused a lot of problems. And measles, as one of the other physicians mentioned, is a very serious disease. But in the real field, particularly for like influenza or other things, we never achieve herd immunity, either by the people who've gotten sick and the number of people who've gotten vaccinated. But for this one, I know you can't twist people's arms. You have to answer questions. I think all of us are here to do this, as all of your healthcare professionals are. But my hope is that as many people out there who are listening, please, please, please get vaccinated. I can give you, you can even write me, and I'm Howard at umich.edu. That's how long I've been here. But we can send you the right reports that will get you the information that this is not only safe for you and your family, but it's safe for your community, because this is a socially mediated disease. And if I have it, even if I'm asymptomatically transferring it to you and don't know it, I can easily do that through talking, coughing, singing, what have you. So we all have to, we always talk about we're all in this together, we're all a community. This is where we really need to be a community, and we need to get this vaccine so we stamp this out and get out of
Thank you so
this.
much.
And get out of it.
I really appreciate that you named that false claim of a connection to autism, because that is something that pervades in our communities. And, it's hard as a mom or as a non-physician to know where to get information and what to believe. And sometimes when we hear something enough, you start to believe it's true. And so I appreciate that we have 4 experts here, each of whom is saying to us that is a false claim, to give us some confidence that we can let go of that belief. Mm-hmm. I used to live in Orange County, California, so I know exactly what you're talking about. And definitely
there was an outbreak in Disneyland.
Yeah.
There was an outbreak of measles in 2014.
So to that end, as some of our community members, as all of us are evaluating getting this COVID vaccine, let's hone in on that vaccine a bit. Help us understand a little bit about the risk. How do you weigh the risk between actually getting COVID versus getting the vaccine? Because there are folks who, again, are not certain about getting a vaccine and kind of feel like, well, if I get COVID, maybe that's not as bad. Well, tell me about that on an individual and as a group. Looks like Dr. Castillo is looking to get in here. Go ahead.
Well, I think it's very important to know each person's medical history. It's important to know what risk factors we have in order to get COVID, and the other thing too is to consider if we're going to develop COVID as a moderate or severe illness. Unfortunately, fortunately, we know there are some risk factors that can contribute to a moderate to severe illness, like chronic diseases, for example, obesity, hyperlipidemia, diabetes, hypertension, chronic kidney disease, lung disease. So we know that people who have these diseases have a worse outcome in terms of if they get COVID. So there's been a very big push for obviously, people who have these chronic medical problems to get vaccinated, because we know that vaccines are going to help to prevent very bad outcomes from COVID-19 and are going to help to prevent hospitalization, are going to help to prevent intubation, are going to help to prevent, long-term, outcomes from the infection. So it's very important to know which risk factors we have as a patient or as a person in order to know, okay, it's better to get the vaccine to protect myself and protect others.
Great, thank you. Dr. Cunningham, I saw you trying to get in. Go ahead.
Can you hear me now?
I can hear you now.
Great. The other point is, it's not just what is your risk for getting COVID. Are you going to bring it home and spread it to your parents, your neighbors, your friends who may be at even higher risk for COVID infection because of pregnancy or cancer or some other medical problem? So I look at this, we all need to take this vaccine. And to put things in risk, we all have a much bigger risk getting in a car or bus and going to the grocery store and getting in a car accident and getting hurt or killed than getting a severe reaction from this vaccine. And this paper tells you what I think about it. It's my vaccination that I've had my 2 doses, and I can't stress anything more than that. I thought it was safe enough. I wanted to get it to protect myself, my family, my coworkers, and my patients.
Thank you so much. That's quite a testament. We appreciate it. Oh, and there's another one. Okay, so let's get in a little bit more. So, a practical question: one gets the vaccine, how long does it last? How long is it effective?
We don't know yet, but we think many months or more, maybe a year or two. What I have been predicting, historians are not the guys you want to predict the future. We don't do that as a rule. But what I've been sort of sussing out is that this will be, I think we'll have COVID in our lives for a long time to come. And there'll be different strains or different variants or completely different cousins or relatives of COVID, and that we may be getting a COVID vaccine on an annual or semi-annual basis as new variants come, just like the flu vaccine. So we should be prepared for that. But the answer to your very good question is we don't know, but we hope certainly for long enough to make this thing go away for a while.
Right.
And there are some studies looking at this where volunteers who are initially vaccinated are agreeing to donate blood periodically to measure antibodies. These are proteins our white blood cells make to fight different infections, and you can measure the antibodies against COVID. My guess is the protection is going to be at least a year, just based on similar immune response to other viruses in this family. But I agree that I do suspect that we're going to wind up having almost a COVID vaccine every year, such as a flu season. I think we're going to have COVID season. I don't know that for sure, but that's what my bet would be if I was in Vegas right now. I wouldn't make a big bet, but I'd bet.
So we want to talk a little bit about now, our youngsters, right? As of right now, we don't have a vaccination for children under the age of 16. And so, Dr. Bryce, maybe you can talk a little bit about how can parents protect their kids? And what do you see in terms of on the horizon, when will we potentially have a vaccine for our young kids?
Great question. I think, so what we're saying to our patients here at CHAS is, you're still going to continue with those same recommendations, even those that have been vaccinated or have families that have a few people that are vaccinated, in terms of, wearing your masks, socially distancing, if you're going to be doing events, trying to get those to be outside. So those recommendations are still there, and I think are still powerful to contain this virus for sure. In terms of the vaccine, I think, I can speak to just this idea of the safety. For when I have patients that ask me if I would, what my thoughts are on the vaccine as they're making the decision, I kind of tell them the way that I decided to take the vaccine, or why I recommend it for my patients, or why I recommend it for my parents is, first thing is looking at the safety. And all 3 of the ones that are available here in the United States right now, the safety profiles are very, very good, which is great. So if it's safe, then I think the risk is worth taking it. And then, of course, now we're finding that they have pretty large benefits, huge benefits that can make a difference. And so the first step, of course, is, we study these vaccines, if it's greater than 16 years of age or 18 years of age. Of course, we didn't study them initially in pregnant women as well. However, the safety profile seems so good at this point that, we are to the point, and not putting pressure on any pregnant women, but we are recommending that pregnant women, if they want the vaccine, they have the option of the vaccine, understanding, once again, the benefit of taking it could be so powerful. And my guess, and maybe Dr. Cunningham as a pediatrician can speak to this as well, for our kids, when it's available, I think we'll probably still be recommending it. Obviously, it's a little bit behind because that's not who we initially studied. their risks are probably a little bit less compared to our elderly population. But I think we will obviously get to that point because we know they can be a vector or somebody that can transmit this disease to other people. And so my assumption that will be coming soon. But Dr. Cunningham, please, from your perspective as well.
I think what you said is very reasonable. I know there's a couple trials right now where they're studying the vaccine in children. I am hoping I have some news about a study like that in Detroit in the near future, which would be wonderful. But Pfizer, we can give it to people as young as 16 years of age. The other vaccines as young as 18. And my teenager who is 16 and a half, I will ask her to get the vaccine when it's her turn in line.
Dr. Castillo-McKenzie, can you elaborate a little bit on the vaccination of pregnant women and any impact on pregnancy for women who are trying to conceive and breastfeeding moms? I'm the mom of a 5-year-old and a 5-month-old. And so this weighed heavily on my mind when I was considering the vaccine. Would love to hear your perspective, given that you're an OB and this is what you do all day.
Well, yeah, well, actually I'm family medicine, but I also see pregnant patients. And so something very important to note is that in the clinical trials from these vaccines, as Dr. Bryce mentioned, pregnant women were not included. So there's luckily, what we've seen, and fortunately what we've seen and what scientists have seen, is that the safety of the vaccines in pregnant women is very high. It's recommended that as a pregnant woman, you talk to your primary care provider in regards to the risks that you have or the benefits of the vaccine, which the benefit outweighs the risk, basically, outweighs the risks. And especially, for example, if you're a woman who works in like with the public, if you are an essential worker, if you work in healthcare, so if you have a high risk of getting COVID, then definitely the benefit of getting the vaccine is really going to be very important, especially because we do know that there can be complications to pregnant women and to the babies. So it's very important to have this conversation with your primary care provider, with your gynecologist, and it's important also to note that the American College of Obstetricians and Gynecology, they do recommend to get the vaccine, but they also mentioned that it's important to have this conversation. And also, there's the CDC is following approximately 30,000 pregnant women who have got the vaccine. So they are keeping an eye on terms of like if they get to see any side effects or things like that, and luckily nothing has been reported yet. So which tells us that the vaccines are very safe, and you're not just protecting yourself, you're also protecting your baby. And the same way for women who are breastfeeding. So definitely it's recommended to get the vaccine if you're breastfeeding. Me personally, I'm breastfeeding and I got my vaccine, and I'm really big promoter of getting the vaccine, the importance of getting the vaccine. And actually there was a recent study or it was recently published that that you can see antibodies COVID-19 in breast milk. So this is very important for every woman who is breastfeeding. And then also we have not seen any risks for those women who are planning to get pregnant and get the vaccine. There is no correlation there. We haven't found any issues with infertility. That's not true. I think that was, in social media at some point, that these vaccines cause infertility, and that's not true. The vaccines will not cause infertility. The vaccines are going to protect us, and they're going to protect our babies too. So as a woman, with a baby, and I'm still breastfeeding, I definitely recommend to get the vaccine and to protect your baby.
Great, thank you so much. It's very reassuring to hear all of you say that. And the common theme that I keep hearing from all of you is information, and accurate information is key. Individual patients have to weigh their own risks and come up with the solution that works for them. But it's incredibly important to have that source of information, that connection with your physician and medical provider to make sure that folks are making informed decisions. As we sort of close out our panel, I want to talk a little bit about, now that we are living life after vaccines, right? We've got some folks in society that have already gotten their vaccines, and slowly we're going to start to see that critical mass build. So we want to learn a little bit more about what can people do safely once they're vaccinated, and how should unvaccinated and vaccinated people interact with each other, especially when we consider kids. So we'd just love to hear some advice from you on how we continue to live our lives as we have a society that becomes more and more vaccinated against COVID-19.
Well, the CDC guidance is quite clear that we should continue to wear face masks, even if you have been vaccinated right now, and practice social distancing. There is that one really vast and scary category of those who are asymptomatic but can somehow transmit it, or that children can somehow do that but not be sick and transmit it to their elders, particularly those who have problems. So that we're still trying to get a grip on. But if you do go to a grocery store, for example, this weekend, even if you were vaccinated, I would tell you to wear a mask and to practice social distancing. And it still comes down what I call the 3 Ds. So the duration, how long are you with other people that you don't necessarily know? The distance, how far you are away from them, and the diversity, how many different people. So how long, how many, and the distance. And because exactly, I think Dr. Cunningham said it very well. We literally are, I hate that phrase, we're all in this together, because it reminds me of High School Musical, which was wonderful when my daughters were 6 or 4, but after about 100 times, it kind of gets in your head. So now that's in my head again. But anyway, we are all in this together, because if we don't stamp this out through vaccination, the opposite of herd immunity happens, and that the disease becomes endemic. And then you have pop-ups of coronavirus, which also has the potential to change and mutate and potentially make us even sicker. But you'll have it in New York, let's say, but not in Southfield, Michigan, but then it'll pop up in Cincinnati. And we'll be playing this game of whack-a-mole. And that's why it's so important for all of us to get on board and do this as a country to try and achieve as much immunity as possible. It's a long road to hoe. I heard a poll on NPR just yesterday that half of the people who voted for Donald Trump do not trust vaccines, particularly those made by the government, and have a real hesitancy to take them. That's a lot of people. That's a lot of people we have to talk to.
I think we need to get used to a different way of life. We can still go about and enjoy things. I really love doing things outdoors because you can distance more and you're less likely to become infected with air moving around. Wearing masks, my family makes fun of me. I forget I'm even wearing it. I'll get in the car after grocery shopping and I'm still wearing it when I get home. The masks are just going to be part of life for a while. And I keep a little alcohol gel in my car. So after I go on shopping or I'm pumping gas, I can just wash my hands real quick. Vaccines are an amazing public health intervention, and so is running water with soap to wash your hands or using these alcohol-based gels. Either one of them is a really nice way to help disinfect.
And I think something important to remember is, when are you fully, vaccinated? When can you tell that you're fully vaccinated? So it's 2 weeks after you get the second dose of the Pfizer or Moderna vaccine, or after you get the only 1 dose of the Johnson & Johnson vaccine. So that's important for, everybody to know too.
Great. Well, and I think that's going to be super important for all of us to sort of have that awareness, right? Everything you mentioned, just because we are vaccinated doesn't mean we let go of some of the habits that have now become a part of our lives. I mean, truthfully, we probably should have been washing our hands a lot more than we were. And so that, I, for one, am glad that that's become a normal habit. Masks, you're right, are just something that, we have to get used to, just like socks and gloves and hats in the winter. So we just, it's our new sort of reframing our expectations and reframing what we consider normal. So, and absolutely the idea of when are we actually fully vaccinated? So I wanted to also ask you all, as before we close out completely, I wanted to ask each of you to share with us what are you hopeful about And just, a couple words, because they're about to put the hook on for all of us. But what's a couple words of hope to give our audience as you look forward to the next coming months?
Rajeshri, before we go to hope, I have one more question that's linked to something that we have been talking about throughout the program. Many of us parents are thinking about summer, and schools have started to talk to us about summer school, face-to-face summer school, that kind of thing. Do any of you have advice for parents around our children getting into more face-to-face activities, and what the vaccine means for our children, going more face-to-face?
My biggest concern right now is when kids have been doing all this virtual learning, they've lost out on a lot of social interaction. We know that mental health issues have worsened or become even more prevalent because people don't have these support systems. So I would really encourage people to try and let your kids hang out with their friends more. Outdoors, again, is great, especially with the beautiful weather. Have them wear the mask. But I really think that going to school in person, being able to participate in sports and other social activities is essential for our kids' well-being. Life is not going to end because of COVID. We do have to adapt a bit, but I want them to be able to enjoy their childhood as well.
Anyone else?
Well, my hope is contained in a hypodermic syringe. It's 2 words: the vaccine, the vaccine, the vaccine.
There's also some glimmers of hope. There have been some people who have just done wonderful things, taking care of their families and neighbors and taking care of patients. There's been a lot of wonderful, wonderful things people have done. And I think it's so easy to look at overwhelming negative things in the news, but there's a lot of good stuff going on as well. And let's keep that hope.
Very good thought.
And I agree with that too. Personally, I've seen kids in my practice where they're really suffering with virtual learning. It's hard, and they really benefit from, going back to school. And like Dr. Cunningham mentioned, we are seeing more issues with mental health disorders in younger kids too. So it's been very stressful for everybody, for us parents, for the kids. So I think, obviously we all want a break, but we still have to follow preventive measures. And it's very important for the kids, to interact with other kids. And that social aspect of their development, it's key for them.
Nice. And then I'll just follow up with Dr. Castillo as well. I think the hope for me just comes from, I think the personal connections overall, especially from a community. I feel like that's been a challenge, right? Lots of virtual stuff, which I think is great that we have this opportunity to do this today. And it's obviously a lot more convenient for everybody, but there is something about being together with people. And so looking forward to trying to make those personal connections physically, even if it is socially distanced, more in the future.
Thank you so much. I think that's a great way to end this segment with that piece of hope and the fact that we are headed for better days, and things are definitely looking up. So thank you so much to all of you for being here and sharing your expertise with us. Christine, I'll pass it back to you.
We want you all back. So you guys just gave a wealth of information. So don't be surprised if you get another email requesting your presence. This was incredibly helpful for us, and incredibly helpful as a parent to hear your hopes, but also the science. And I actually was very nervous about taking my second shot because I happened to read an article about a woman that took her second shot and died. And so this is, you just really talked me off a ledge. Thank you all so much. And thank you to our other panelists. We really appreciate you being here with us today. and sharing your knowledge. It is so helpful as we, continue to live with COVID, and as we start to think about how do we come out of the pandemic, because as the doctor said, there's hope for that too. So we just want to let everybody know, if we didn't answer your question today, we will get your answers and post them on onedetroitpbs.org and on the DPTV Facebook page. This town hall is truly, truly a group effort. And so I'd love everybody to turn their videos back on. And we want to remind everybody, as we've said every week for the last 52 weeks, stay healthy, stay powerful, stay strong. And Ophelia, can you please say that in Spanish? Oh, she's not here. Brooke, will you say it in Spanish for me? After 52 weeks, I should be able to say it in Spanish is really the key. That is the key.